What is insurance?
Sure. Insurance transfers certain risks between parties.
Without insurance, the economy would really stop.
In simple terms, insurance is like community.
It's protecting every last asset that somebody has built over a lifetime.
You're in it together. You feel supported.
From the beginning to the end.
What insurance is just taking care of people. It's definitely a way of life.
Hello, everyone. Thank you for joining us for this GlobeDocs screening and discussion of Black motherhood through the lens. And my name is Lauren King, and I'm so pleased to have as our guest the film's producer and director, Dr. Osinubi. Besides being a filmmaker, Ade is the emergency medicine resident physician at the University of Pennsylvania. I mention that because I'm sure that played into why you wanted to approach this topic for a film. And I hope that you could start by telling us what drew you to the project and what made you want to share these stories with audiences.
Hi, everyone. Thank you so much for having me. Really excited to be here to discuss my documentary, Black Motherhood Through the Lens. So my journey with documentary film actually started in high school. I co-produced a documentary about obstetric fistula. For those of you who do not know, that's a birth injury that oftentimes impacts women in low-income settings. And so from that experience, I saw just how powerful documentary film was as a tool to raise awareness about various social issues and health inequities. And so when I started medical school back in 2018, there was a significant amount of media attention surrounding the Black maternal mortality crisis in the United States. So for those of you who do not know, the US actually has the highest maternal mortality rate than any industrialized nation. And so according to the CDC, in 2021, the maternal mortality rate for Black women was actually 2.6 times higher than that of white women. And in some states such as Louisiana and Georgia, that rate might be up to 4 times higher. So as a medical student at the time, now as a physician, and as a Black woman, this issue hit quite close to home. Mm-hmm. And I decided to address this topic through documentary film. And through my film, I wanted to also highlight various aspects of reproductive health, such as infertility and postpartum mood and anxiety disorders that also disproportionately impact Black women. So that's how Black Motherhood Through the Lens was birthed.
Mm-hmm. It seemed like it was shot in Providence and around Rhode Island. Is that where you were at the time?
Yes, so I did attend medical school at Brown University. I was also there for undergrad. And while at Brown, I had a great mentor, Dr. Teresa Schrader, who does a lot of media and medicine work. And she was instrumental in helping me create this film. 3/4 of the film was filmed in Providence, Rhode Island, and 1/4 was actually in New York. So you can definitely see a bit of a setting change there.
Yeah. And how did you find the 4 women who share their stories, in very different experiences in this?
Yeah, that's a great question. I like to say it was divine connection. I'm a woman of faith. And, when I started this documentary, I was like, how in the world am I going to find women who are willing to even be so vulnerable and share such personal stories on screen? And so for the various 4 women, there were different stories. So I actually met Shailene Costa through an advocacy event in Rhode Island. Unfortunately, at the time, there was a case of a Black maternal death still in Providence. And so there was an event surrounding that death, raising awareness and also advocating, against Black maternal mortality. And so that's how we met. And she actually shared with me her experience with infertility. So that's kind of how that storyline transpired. With Shannon Benjamin, I was connected with her through a Black OBGYN mentor at the time, Dr. Lene Brayboy. She was like, oh, I have a friend who's 8 months pregnant. And I was like, oh, this is perfect. And so I remember meeting Shannon in a coffee shop on close to Thayer Street. If you're from Providence, you may remember Thayer Street. And, she was about to give birth. And so that's how that came about. And then Jamie Potter Rutledge, I kind of knew her tangentially. She actually works at Brown, and we were Facebook friends, and I saw that she gave birth towards the end of the pandemic, and I was really interested to see her experience giving birth during the pandemic. And that's when she shared with me that she had actually experienced postpartum depression with her first child. And then Ijoma, we actually knew each other first. Back in 2017, I used to take pictures for her blog, and she shared on her Instagram page her experience with infertility. So I reached out to her to see if she'd be willing to share her experience. And so that's how I met all of the four amazing women in the documentary.
They really share personal and very emotional material with you. How did you did you cultivate that through conversation? How did you earn that openness and that trust with them?
Yeah, so I mean, it's a two-way street, right? So, first of all, I think them being connected to the vision and the importance of the issue is what helped them, share those experiences and be vulnerable. And they each have, a personal connection and interest in that area. So I think that was very helpful. I think that my identity as a Black woman producer was instrumental in having that trust as well. Also, me being in the medical field. And then lastly, having a really small crew. So I was a crew of one. I was the filmmaker, I did the audio, editing, etc. So it can be really daunting to have such a large crew of people. And so I think it was helpful to have just one person because I think it created that shared intimacy. So those are some of the steps that I took before filming. We met one-on-one, just discussing like their storyline, just so I had an idea of things that they were comfortable sharing, things that they were not comfortable sharing. And then we moved forward with the the interview day and then filming B-roll later on.
I want to just mention to our audience that if you have questions about Black motherhood through the lens, you can use the Q&A prompt at the bottom of the screen and write out a question. And after I've talked for a little bit, I'll look at the questions and get you in there if you have questions for about the film. I was so struck, Ade, by, I mean, there's four women in the film, at least three of them, except for Shannon at the end, whose experience was a bit more positive, talked about not being listened to and just feeling so alone with what they were going through. Did you expect that as in your, in your studies? I'm sure you encountered that, but were you surprised that was such a pretty universal feeling that they had?
Yeah, so unfortunately, I was not surprised. Just being a Black woman myself, knowing people tangentially who have gone through the motherhood process in the United States. Again, unfortunately, these stories are quite common. And so, them sharing their experiences, again, just kind of spoke to the choir, unfortunately, right? And so I think that in terms of moving forward, and, the medical community at large is, doing what it can to address these issues. But I think the biggest thing, and I love this phrase, is simply believe Black women. That's a phrase that, I hold near and dear to my heart, because I think that, once you believe and just truly open up your ears and your minds to their experiences, that's where change can occur. So unfortunately, there are similarities, and those stories are repeated in various media sources, various films, and that's kind of just the reality we're at right now.
Yeah. When I was watching it, all I could think of too is, we're at such a crisis point with the whole medical profession. It was already very fragile, and from what I've read, COVID, has really made things much more difficult. So while I was watching it, I'm thinking, here we're hoping this gets better, but can it right now? What's the state of things right now that might be just making this so much more difficult? The shortages, the short staff, the overburdenedness of the whole medical profession.
Yes, thank you for bringing that up. So, we're still learning the long-term impacts that the COVID-19 pandemic has had on various aspects of health. And unfortunately, maternal health has not been immune to these negative impacts of the pandemic. So for example, the National Center for Health Statistics found that there was actually a 40% increase in maternal deaths in 2021 compared to 2020. The NIH showed that there were an increase of maternal deaths as well. And unfortunately, Black women made up 30% of those maternal deaths, despite making up less than 10% of the population. And so this is not, solely for Black women. Studies have shown that statistics and mortality rates among Native American and Alaskan Native women have also increased as well. So that's just the maternal mortality piece. And when you want to think about postpartum mental health as well, research from the University of Michigan actually showed that 1/3 of new moms experienced postpartum depression during the early pandemic. And statistics actually show that typically 1 in 7 women experience postpartum depression. So you can see that increase right there. And I actually did some work with a Black doula collective called Maroon Calabash. They're based out of Milwaukee, and they provide postpartum doula care for Black women and families. And they actually also reported a significant increase in number of women and also men experiencing postpartum depression and anxiety. So prior to 2020, they reported that about 1/3 of their clients exhibited these mood disorders. And in 2020, when it was the height of the pandemic, the murders of George Floyd, et cetera, that number increased to nearly 100%. So it's not just maternal mortality, it's postpartum mood and anxiety disorders. Also during the pandemic, in terms of assisted reproductive technologies such as IVF, a lot of those things were also on pause too. So it really permeated multiple aspects of reproductive health.
Mm-hmm. Yeah. Also, I was struck by, well, first I want to ask you, did you already know that these were the areas you wanted to focus on: infertility, postpartum depression, maternal mortality, and access? Those were the 4 topics. Or did that come to you in talking with your subjects?
Yes. So before starting the film, I had an idea of the topics that I wanted to cover. They loosely followed what actually came to be. I very much thought of it in different boxes. Okay, one person giving birth, another person experiencing infertility, another person experiencing postpartum mood and anxiety disorders. However, when you actually meet people, those experiences might overlap, right? And so I actually have 2 experiences showcased with infertility. One of them is Ijoma Kola. She speaks more about the psychosocial aspects as well as cultural stigma surrounding that as being an African woman. And then you also have Shailene Costa, who talks a bit more about the access to care issues, experiencing infertility while not having insurance and what that truly looks like. For her, that looked like getting free samples of medications from her doctor, right? And so there are so many facets of these issues. And so it was really until I met the subjects that I was able to create the film surrounding it. So although I had these ideas of what I wanted to cover, meeting the people is what shaped them. Another aspect that I actually was not able to cover in this documentary was infant loss. That's something that's not typically talked about or covered, but it's unfortunately an experience that a lot of people have, whether it's early miscarriage, late miscarriage, and just infant loss. So that's another topic that I'm hoping to tackle sometime down the road as well.
In another film.
Potentially. Potentially.
Oh, yeah, I was so struck by, besides all the frustration they experienced and the dismissiveness they experienced with the medical profession, I was struck by the within their own community, families, peers feeling isolated and alone and not being able to talk about some of this. And what can be done, do you think, to stop that, just from these women feeling so alone and isolated? The third woman, the doula, had a community, and she was able to find help with the breastfeeding and so forth. But I was struck by how alone they felt, which is coming from where you'd hope they'd find a support system.
Yeah. So again, like experiences such as infertility, postpartum mood and anxiety disorders based off of these statistics that I've briefly shared, it's actually fairly common. However, since it's such a personal and emotional experience, it's very easy for people to feel alone. And so I think the more that we share stories, the more that we do events such as these, the more that films and podcasts and articles are written sharing people's stories, I think that really helps to, connect people with one another. And as cliche as it sounds, make people feel that they're not alone. But at the end of the day, it's a very personal experience, right? And so although you may know your neighbor's going through infertility, it's still such a personal process, right? So I think continuing to create these spaces, but also giving people the space to deal with their issues the way that they want to, I think is really key.
Mhm. As you're an emergency medicine resident physician, are you seeing anything that gives you hope in your own sector as you're becoming a doctor and connecting with others and being in the profession day after day, hands-on? What are you seeing, and how is that making you hopefully feel optimistic? I hope you're going to say you're optimistic.
Yeah, so fun story. I was actually going to go into OBGYN, obstetrics and gynecology, and I actually switched to emergency medicine because I realized I wasn't the biggest fan of the operating room. But I figured that working in the emergency department, I'd still be able to interact with women and pregnant women, especially early in pregnancy. So, I've seen my fair share of pregnant women, have had a couple of deliveries in the emergency department, which was quite exciting. But I will say overall, maybe not necessarily tied to my experience specifically as an emergency medicine physician, but my experience as a Black physician and someone who's passionate about these topics, I definitely do feel hopeful that we are headed in the right direction. Although, the statistics that I shared that still show these disparities and show that, there's much to be desired, I'm really encouraged by the amount of organizations, advocacy work, and legislation that's being done and that's focused on improving reproductive health outcomes for Black women. I'll just name a couple. The Black Mamas Matter Alliance is an organization that works to improve birth outcomes for Black women across the United States. Through advocacy, they have their National Black Maternal Health Week that happens every year in April. And they also have a toolkit which provides focused interventions in hospitals and communities to improve birth outcomes for Black women. In addition to that, there is some legislation work that's being done. The Build Back Better Act, Momnibus Bill, which was spearheaded by the Black Maternal Health Caucus, is doing work to expand postpartum Medicaid coverage to 1 year, which I think is really important because oftentimes that care gap can be very significant. Also, it's working to provide more funding for community-based organizations. And then also increasing postpartum eligibility for WIC, or women, infant, and children, to 24 months, and multiple other things. So outside of organizations, legislative work, I think there's a lot to be said about this new generation of medical students and doctors as well, who are really championing health equity. And really making it a point to listen to patients, not to say, the current generation of doctors are not doing that. But I think that since there's more awareness being raised about these issues, more and more medical students, more and more, residents and newer physicians are holding those ideals closer to them and working to advocate for those issues. So based off of organizations, legislative work, and also the medical field as a whole, I do think that we are headed in the right direction.
Oh, that's encouraging to hear. The one that made me so upset was, I think it was Jamie, who said the doctor implied that she would be happier if she was not pregnant. And it was like the complete opposite of the experience she was having. It sounds, it's so dismissive and so ignorant in so many ways. Is that an education component, or just what you're doing, shedding light on this and to talk about what real feelings are going on and to stop making these assumptions that are so wrong and destructive.
Yeah, so a little bit of context about that. It was actually Shaylene's experience. So she trying to pursue having a family around 18 or so years old. And so her doctor automatically assumed that she did not want to be pregnant because she, presented as younger. But indeed, it actually was her desire to be pregnant. And so there is a lot of things to be said about people's perceptions of Black women in general having children and young Black women having children, since it's such a loaded conversation that's steeped in multiple years of history. So I think there's a lot of education pieces in the documentary that show, how physicians with implicit bias, explicit bias, et cetera, can be more cognizant of the words that they're using, the conversations that they're having, and being more aware of the assumptions they may already have about patients.
So at the end of the film, I noticed there were some photos that were you with the women in many cases with their babies. So I'm just curious to know if you are still in touch with them. How are they doing? How was that rapport that you were able to build with them? It sounded like you really got quite close to them.
Yes. Still in touch with all four of them. I reach out to them here and there. It's like, hey, I'm doing this event. I'm hoping some of them are actually on this call today.
Right.
But Gioma now has 2 kids. Shay's girls are like so grown in high school, middle school. Shannon's daughter is now a lot older, and Jamie's kids are growing up. One of her daughter is actually going to middle school. So, it's been really great to just see them on Facebook. Haven't seen them in person since I graduated back in 2022, but hoping to see them in April for the formal premiere of this documentary. But I'm really grateful for the connections that I was able to build, and really grateful for them allowing me into their life.
Mm-hmm. So you mentioned the formal premiere. What is the plan for the film? It's great that it's here in GlobeDocs, but what is the path going forward, and how can people talk to their friends about seeing it?
Yes, so since about 2021 or so, I was doing screenings with portions of my documentary. And now in April, I will be doing a formal screening with Tufts University with their Center for Black Maternal Health and Justice. So I'm really excited about that event. I think it's really fitting to be doing it with a center that is doing really important and innovative research in that area. And so, once that premiere is done, I will make it publicly available to everyone, and that event will be happening around Black Maternal Health Week as well. So I'm really excited about that.
That's terrific. Do you hope that it somehow gets into medical schools or a setting where there is an education component around it?
Yeah, so, I've already been able to do a number of screenings with medical schools as well as hospitals, and I'm hoping that it continues to be used in those settings. People oftentimes ask me, what is my target audience? I think my number one target audience is for Black women, for Black women to see themselves in, but I also want it to be a tool for education, and it already has been, and also a tool for conversation.
Wonderful. We actually have some questions, so I'm going to read those out loud. Well, you talked about this, but this bears more attention. So I'm going to read this question from Mary. It says, as I'm sure you know, the Black infant mortality rate is more than 2 times that of white infants, and the U.S. infant mortality rate has risen for the first time in 20 years. Can you speak to the relationship between maternal and infant mortality?
Yes, thank you so much for that question. So actually, kind of talking a bit more about those statistics, there was a lot of media attention around this time last year. Studies showed that Black infants who were cared for by Black physicians actually had lower infant mortality rates. And I do want to, emphasize, I'm sure a lot of us are aware that, these disparities are not due to any type of biological difference, right? These are due to systemic issues such as racism, such as lack of access to, healthcare resources, and then also differences in socioeconomic status. And I will also point out, especially for Black women with college degrees, for example, are still having higher rates of maternal mortality compared to white women with lower education. So it's not just a socioeconomic issue. So I think really the key and underpinning of these disparities is racism, unfortunately, and health inequity. And I think those are very much intimately linked.
Yes, yes. Another question was about where can we see the movie, and you did address that. So I just want to make sure that's reinforced, that the film will be out there. But if someone has just seen it and wants to share information to a friend or to a colleague, or will there ever be any, say, online access or a way to see it outside of the settings that you mentioned?
Yes, that is the plan. I'm always open to doing private screening. So our website is blackmotherhoodfilm.com. So that is one option to see it between now and April. And once April rolls around, I will do my best to make it as accessible as possible.
Great, great. When you talked about the access, I was very struck by the section about the Black doula, the woman who's a doula. Do you think that people know that, and is that information given to women when they're in the medical settings, that doulas are available, or that they need to seek them out? Is that may not be common knowledge, or certainly not something that might occur, that they can build a community by seeking out a doula?
Yeah, so I think as time has gone on, and one of the positive outcomes of more awareness being raised about the Black maternal mortality crisis is people's awareness about doulas. So for those of you who do not know, doula is basically a person who helps with birth, can help with advocacy in the delivery room. And there's also postpartum doulas who can help with various tasks, like, if mom needs a break, taking time with the child. And then there's also infant loss doulas, among other ones as well. And so I think more and more people are being, more acquainted with doulas as an option for them. Of course, can be cost barriers as well. But for example, the Maroon Calabash Doula Collective that, I got a chance to learn more about, they operate on a sliding scale, for example. So there are some affordable options. And Shailene Costa, the doula in the documentary, she's been doing a lot of advocacy work in Rhode Island in making doulas more accessible to patients. And there's some work for doula coverage to be covered by Medicaid, et cetera. So I do think they're a really great option. And, in terms of, the relationship between doulas and OBGYNs, I think there's a lot of more work being done to integrate them into the birthing process, should that be a desire of the birthing person at the time.
Mm-hmm, mm-hmm. It was Shailene's experience also with the breastfeeding group, I believe. That was so fascinating, that even that, to have women who look like you and going through the same experiences, all supporting one another. I mean, it really speaks to that importance of support groups in general, just that people know what you're going through and can help.
Yeah, actually, before the film, I had no idea that there are these breastfeeding collectives. So she, for some context, worked with Chocolate Milk Cafe, and there's Black breastfeeding groups for women of other identities. And I think that's really great because she raised how she was actually told that her breasts were too big to feed her baby. And that was very much racialized, and I'm really happy that she was able to find that community which supported her breastfeeding for multiple years. So yeah, that was something new I learned in the process of creating this film.
Yeah. Your film is a documentary, obviously very educational. Do you hope that maybe there would be different representations in the media, in popular culture, and to counteract some of the stigmas that are talked about. I mean, I don't know if that's something you're even aware of or want to speak to, but it just occurs to me of this feeling of being alone or not talking about things like infertility or postpartum depression or any mental health issue in general. Could
Clarify your question. Yeah, would you mind clarifying actually?
Do you think that there could be more sensitivity to these issues in popular culture or through the media, other than in a documentary film, um, that would help to break some of the stigmas or the feeling of being alone, not having a support group, not being able to talk about things like mental health, postpartum depression, or infertility?
Absolutely. I have seen a good amount of representation on, I enjoy reality TV personally. So I have seen a good amount of representation of women discussing their experience with miscarriage and infertility, or just the process of giving birth, more so in the past couple of years. Actually, when I was doing research and creating this documentary, I was looking at the existing films that, talked about experiences with postpartum depression. There was already not many of them, but of the ones that existed, it primarily highlighted the experiences of white women. So I think it's important to have continued diverse representation in documentary film is one element, but reality TV is a place where I've definitely seen a lot more representation. So I definitely think we're headed in the right direction.
People talking about their own experiences. Yeah, yeah. So you mentioned that you might want to do a film about infant mortality or losing an infant. Do you have an idea for your next film? Are you
Yeah. So, my overall vision for my career as a physician is to practice clinically, but I'm very much interested, as you can tell, in documentary film and producing. I really love like 8 to 10 minute shorts. And so that is something I am looking to do in the future. I don't have any plans just yet because, residency is very rigorous. But that is an aspect that I'm hoping to shed light on in some shape or form. If it's not documentary film, it could be writing. For those of you who don't know, I do write for the lay press about various health topics, including sickle cell disease, early puberty impacting Black girls and Black women, etc. So if it doesn't take the shape of film, it could be in the shape of writing too, which has been a more accessible medium for me as a resident.
Yeah, yeah. Film takes a long time, and yeah. But that's something you're committed to. I mean, you plan to make another one.
We'll see. We'll see. I definitely see myself continuing to create films. It's something that I really love to do. It's something that I just feel like I have a natural eye for. So it's something I definitely want to continue to do in the future.
Well, we certainly hope we'll be hearing more from you, especially around these topics that are so important. Thank you so much for joining us for this discussion about this very important topic. And I'm so glad that the audience could stick around and share in it with you. And thank you for their questions. I was going to wrap. I do see one more question here, so I think we have time to take it. I'm sorry, I'm just trying to get the question here. Okay, there it is. Fantastic discussion. And what would you say is the next steps that can be taken to further improve health equity for Black mothers and birthing people?
Great question. So kind of going back to what I previously had said, is one of my favorite slogans in medicine is believe Black women. So, if someone's expressing to you that they're in pain, that something doesn't feel right, as easy as it sounds, not dismissing them, and also, doing your due diligence to make sure you're giving them the best care possible. I think from an organization standpoint, supporting organizations that are doing this work, such as the Black Mamas Matter Alliance, the National Birth Equity Collaborative is another one. And I think grassroots community organizations have been really instrumental in working with birthing people in various communities. So I think those are just some of the steps. And, if you're interested in legislation, if you're interested in lobbying, there's a lot of work that's being done in this area as well. The state of California has actually made really great strides in this area. So those are just some of the ways.
Wonderful. Well, that was a great question to end on. I'm so happy that you joined us. I'm glad that everyone participated and was able to ask such good questions and spread the word about Black motherhood through the lens. Osinubi, it's been great having you here as our guest at GlobeDocs. Thank you for your time and for such an interesting discussion.
Thank you so much for having me. Thank you all for joining.
Thank you. Bye.